Part 3 of Child Abuse and Neglect is going to address who is at risk. We'll begin with families. What are some of the factors that will increase the risk that child abuse can occur? Well, first of all, we're going to begin with being isolated socially because you're so busy taking care of your children, or you don't have any friends, or you have a domineering significant other that doesn't allow for any kind of assistance. When children are competing with one another to gain the attention of their mother and father, altered family roles, someone who thought that they were going to be the breadwinner isn't and now has to be the child caregiver, and it is a blow to their ego. If there are rigid traditional roles and or rules that really can't be followed, this increases the potential for abuse to occur. Another risk are those who solve conflict by being aggressive and assertive. Having a family member who is dominant and controlling is another risk factor, and poor communication among members of the family. If there's a family history of abuse, there is an increased risk that the parents will become abusers of their own children. Anything that causes instability within the family environment, joblessness, homelessness, drug abuse, excessive alcohol use, or mental illness increases the risk that a child can be abused. And then, of course, we need to have the child who is put in front of somebody who has the potential to cause abuse or neglect for a variety of reasons. So children that have increased risk include the premature infants, because after all, they may have been in the NICU for 3 or 4 months, and the parents have been at home, they've resumed their lives, and so there hasn't been the bonding that would have occurred had this child gone home with them. Children who have chronic illnesses are a huge burden on family life. Children who have behaviors that are difficult to deal with. They're always irritable. They're hard to feed. Their cry when they get angry or whenever anything is wrong is high-pitched and it's irritating. Children who have ADHD or they're very destructive are difficult, and it increases the potential that the parents are going to snap and hurt the kid. And it doesn't have to be the parent. Remember, it can be any of the caregivers. Also, defiant, aggressive behavior, disobeying the rules. And so when you think about it, that's going to be your school age and your teens that are going to be more prone to this type of behavior. Family patterns, it depends on the birth order and the gender. If they really wanted to have that boy first, but they got a girl, this girl might be picked on because, and the second child who is a male is the favored one. A passive child is also at risk of being abused because they don't fight and they allow someone to harm them. And then there is the scapegoat in the family. Whenever anything goes wrong, one particular child is going to be the one that's going to bear the brunt. When we look at consequences of abuse, they can be short-term or long-term, but it's really difficult to measure, and everybody is an individual and handles the situation different. But some of the things that we might see is this child may develop poor physical health. Poor mental health, you can certainly see why that would occur, because they do not have the mentality, the ability to think through why something is hurting them. Why does a mother or a father or a caregiver who's supposed to be loving me, why are they hitting me? Why are they hurting me? Why aren't they feeding me? Cognitive dysfunction can occur, especially when the nutrition has been withheld. We see these kids reaching out for any kind of attention, and so one of the things they do is they engage in risky behaviors. And then, of course, they develop behavior problems when they are put in a setting where everybody has to sit down, pay attention, follow the rules. So the poor physical health can be chronic fatigue. They can have an alteration in their immune system. Obesity, as I mentioned, especially when there's sexual abuse. They can develop hypertension. It's a very stressful lifestyle to be continually abused. And then we have sexually transmitted diseases. When we look at the psychological component, there's depression and anxiety, the eating disorders, and suicidal tendencies. And these kids, as they grow into adulthood, can have permanent post-traumatic stress disorder. The risky behaviors that we might see is turning to alcohol, drugs, and tobacco, voluntarily engaging in sexual intercourse at a very young age, having multiple partners because they are each soothing to them, and then the high rate teen pregnancy because this child wants to prove that they're worthwhile and they would be a far better parent than their parents might be. Behavior disorders include being aggressive, being abusive, and being violent. And this can be to other kids within their classroom, within their families, or just a random kid on the street. And this leads to an early life of crime. Our adolescents are the most vulnerable within the population in the United States. Their means of addressing what's happening to them is to leave their home and they end up living on the street. Oftentimes, they end up turning to prostitution as their livelihood, and they get into drugs. And this is the only way that they can survive. And as rough of a life as this is, it's far better than being at home. For some, any of these behaviors, no matter how painful they may be, no matter how risky they may be, they are far less painful than their experience within the abusive environment that they have escaped. This ends part 3.